So yes, we're just going to wait another minute or so, and then we will start this session. We are recording this session, so it will be available to you to access after this as well. And we will also be sharing the slides after this as well. So if you want to just say hello, say very happy to say hello, tell us who you are.
Hi, I'm Jo Willis. I'm the Quality and Governance Lead for Northern Healthcare, and I'm also an RMN. We've just recently been inspected by the CQC, and we're really keen to move to outstanding, and part of what we want to do is start getting involved in some research in the area of supported living and mental health.
Brilliant, lovely.
Thank you.
Who else? Anybody else want to come on? No, I can see Michael. Say hello, Michael. Right, well, it is 12 o'clock now, and a very warm welcome to you all for this fantastic session that Paul Clarkson is going to be running through with us on contributing to and creating research with the Research Funder. So I'm going to pass over to Paul, and he will take us through this session. Thank you. Over to you, Paul.
Thanks, Sue. Hi, folks. How are we all today? It's cold here. I'm on the edge of Greater Manchester, West Yorkshire, so it's very cold. Hope you're okay here. My name is Paul Clarkson. Now, I'm a senior academic researcher at the University of Manchester, but I also have a lot of other hats to do with the main research funder in England, which is NIHR. That stands for National Institute for Health and Care Research, if people don't know that. And those other hats are listed there. My background is I was a social worker in mental health and on medical wards for many, many years. And then I went into research, university research in mental health and more latterly social care. So I'm a social care specialist researcher at the University of Manchester, lead on social care research. And as I said, I'm particularly embedded in some of the infrastructure that the Research Funder has, including advice infrastructure. So I'm going to orientate this presentation towards how you can contribute to or create research with that research funder, funded by that research funder. But my talk is orientated specifically towards social care providers who often don't know too much about the research funder and what it all entails. But I notice we've got a trust representative here, which is great, in the audience as well. So I'll temper that a little bit with some advice about the research funder from that point of view. But it's very much orientated towards people that are not sure about it yet and giving you some pointers and advice and help. And right at the end of my presentation, there'll be a really nice slide where you can actually access help from the research funder in terms of advice and further guidance. So hope that's useful. So I'll start the presentation now. So this is what it's about today, really. I'm hoping to explain the nature of academic research with you, because that's often misunderstood, with England's primary research funder, which is NIHR, National Institute for Health and Care Research, and how social care providers in particular can engage in and contribute to social care research. But not just providers with the audience that we've got, it's in general anybody, any professional, any practitioner out there aligned with researchers at universities. Or initiate your own research in collaboration with university researchers. So it's how you can collaborate and join research, or initiate your own research if that's what you'd like to do. There's a couple of what we call learning outcomes, in education. This is what I hope you will gather from my presentation today. So I want to talk about the difference between formal research as envisaged by the funder NIHR and what we might like to call intelligence for providers, because research is often misunderstood, or there's a little bit of an misapprehension, I think, about research funding and what it entails and what research actually is. That might sound a bit strange to some people, but my conversations with providers in particular tell me that that's often a confusion. So I hope to give you some guidance on that. I'd like to talk about also the difference between research funding, like NIHR provides, and perhaps other sources of funding and pots of money that you may find that you'd like to access to support your businesses, your providers. Thirdly, I'd like to stress the importance of demonstrating a pathway to impact in research in the social care sector, and that's applied research funded by NIHR that is more than just exploring issues and creating information. It likes to affect change in practice. That's the whole rationale of the research funder. So there's a pathway to impact of the research there, how it can change practice in the future. And lastly, and this is the last couple of slides, is how to access further support. So I'm a representative of NIHR, one of the parts of its infrastructure that offers support, and you can access that directly at the end from a slide that I'll give you, so that I hope that's useful. And that's developing your research ideas, applying for research funding, guidance on how to do that, much more detail than I can provide today. So today is a bit of a starting point for you, and lots of information in the slides for you and links for you. And Sue's going to share those afterwards. Thanks, Sue, for that. So I'd like to start, first of all, with a little bit of a conundrum that often I experience when I'm talking to social care providers in particular. This is the difference between research, which NIHR funds, and what we might like to call intelligence or business intelligence. Sometimes providers, I think, mix the two up or get confused between the two. Both are important. Both have pots of money that you can access, but NIHR is a research funder. So basically it's giving research funding for research, not for business intelligence. So the two are quite different. So research, really, just to explain to you if you're not familiar with research funded by research funders, is systematic. It's creating systematic work undertaken to increase the stock of knowledge, and it involves the collection of data, organisation and analysis of evidence to increase understanding of a topic, a particular issue. And it's characterised in particular, and this is the most important thing I think, by a particular attentiveness to controlling sources of bias and error in the information. So it's systematic production of information and inquiry, but it uses academic statistical methods, qualitative methods to control for sources of bias and error in that information. So it's sort of objective, independent from what you might think is your opinion or bias about an issue. So that's research. Intelligence, you probably all be familiar with if you're from a social care provider. You often analyse data and information. You deliver data and information to somebody, perhaps another provider or government or CQC or whatever. And that's information to enable you to make informed business decisions so that you can innovate your practice. That's slightly different because it hasn't got a kind of systematic structure over the top of it. It's basically up to you what you do with your information. It's your information and it helps your business. But the NIHR can't give you funding to help you do that. That sort of funding might come from elsewhere. So just at the bottom of that slide, really, both these aspects will help you innovate your service. But their funding source and what is expected from that funding source are quite different. So I'll go into that a little bit later. Next slide, I think. So this is the main website of the National Institute for Health and Care Research. It's at the top there in that web link in bold. So please, explore that web link after this presentation or at your leisure. Now, NIHR is a huge infrastructure as well as a research funder. It's the main research funder in England. Other research funders do exist. For example, UKRI, Economic and Social Research Council. You might have heard of those. They've got a particular sort of style of research, those other funders. It's perhaps more exploratory, more creating knowledge and transferring knowledge to people. NIHR is very applied research. Basically, the reason for that is NIHR is basically the research arm of Department of Health and Social Care. So it's Department of Health and Social Care funded NIHR as a research arm, and it basically used to be the research arm of the NHS. So it's still very NHS driven, and NHS, the comms are very NHS still, but it's changing slowly. It's only in the last few years has it taken on the mantle and the title of social care research as well. So they're still learning, and people like me often advise NIHR how to do their comms a little bit differently. So you'll see that main website sort of entry there has got somebody with a stethoscope, treating a small child, and social care providers don't know anything about that or don't do anything like that. So it does need to change its comms a little bit. It's probably the biggest research funder in Europe at the moment, NIHR, and it does work across other countries as well. So there's a global research stream as well. As I said right at the beginning, it's very applied research it funds, not business intelligence. If you're looking to pots of money to, for example, innovate and get something off the ground, for example, pot of money to get a tech off the ground or some change in your service, other sources of funding like the Transformation Directorate, for example, NHS England, do provide that. That's not tied to research. You don't have to enter the research system and systematically research information, etc. So there are other sources of funding around, but I'm just going to talk today about research funding from NIHR. So have a look at that research website at your leisure. It'll open up other sites. There's a massive infrastructure in NIHR, and it can be quite confusing. There's all sorts of links in that main site, and as you see at the top, you've got health and care professionals there. That would be a useful one. Researchers, patients and the public, partners and industry, and about us. So have a look at those additions to that site. That's the right word. Now, the important thing about research, as I mentioned, research is quite different to getting information, getting funding for business intelligence, for example. In the research in the UK, definitely is very highly regulated, and so a lot of my job as a university research is coping with all that and the paperwork. There's a vast amount of paperwork, and it's just to tell you about that, to kind of see what you're getting yourselves into really. Research is governed by the Research Governance Framework for Health and Social Care, you see there in the slide, and there's a quite recent UK policy framework for health and social care research. These are legal requirements, so things like going through an ethics committee to get your research started. You can't start research without ethics approval, and there's all sorts of requirements for researchers, sponsorship of research by a body, usually a university, because that has an R&D department, but NHS trusts do sponsor research. The difficulty with social care is we don't have that research infrastructure. So local authorities, for example, if you're thinking of social work research, for example, in local authority or adult social care function, of the local authority, they don't have an R&D department anymore. So it's very difficult for them to be sponsors of the research legally. Also quite difficult for some small, medium-sized providers to sponsor the research. So often you have to align yourself with the university or a university research team, and more about that later in how you can do that. So it's very highly regulated, very systematic, lots of hoops to run through. The research funding is provided on application, so it's not a pot of money that you apply to and just get. You have to apply to it, and it's not always successful. So there are research panels that decide on your application. So there's a whole process, all sorts of legal governance around it, and it's just to be prepared for all that. But people like me can advise you on all that and more about that in the last couple of slides about where you can go for advice. So that sounds rather negative, but it's just to kind of make you aware of how huge research is and how much paperwork it is. This is the NIHR infrastructure in a bit of a nutshell. It's an attempt by me to drag it all into one slide, which is quite difficult because it is a huge super tanker, NIHR. So the main thing it does is fund research, which is that second column. And as I said, you have to apply for the research as a lead researcher. That can be a researcher that's in a trust or a social care provider. Or you can be a co-applicant or a collaborator with university research teams yourself. So you're not in charge of the research, but you're helping, you're part of the team. And there's a huge amount of different streams of research funding from NIHR, both social care specific and not. All the streams do include a kind of commitment to social care research, but it can be quite confusing when you go into the NIHR website, what the streams are called, what they're for. They all have different functions. A vast amount of information there. So we can sort of start to unravel that for you by giving you advice, which is in the latter slides. But just to tell you, it's a huge infrastructure, huge amount of funding, millions of pounds per year is spent on research. So its main function, NIHR, is to fund research, but it also has these different parts of its infrastructure. So there, right on the left, is something called the NIHR Academy. That's like a training arm of NIHR, and it funds development awards, for example, PhDs, master's level awards, which are called fellowships. There's a stream of funding now that helps to develop practitioners in health and social care, professionals like yourselves, to gain higher degrees or gain experience to prepare to apply for a big research funding stream. So they're called pre-application awards. And the NIHR Academy, which is part of NIHR, but does a separate function, funds all that. So there's a separate stream of funding for what you might call development awards and awards for you as a person and a profession to get into research, rather than research awards, which are part of a team of researchers to apply for big research grants. Next on the right to research grants is the Research Support Service, the RSS. This is part of NIHR that helps and advises grant applicants, advises them how to apply for grants, what to do, what the infrastructure is, what the sources of funding are, what a research project might look like, helps you create a research project, basically create a research application. So that's free and confidential advice on activity, and it also funds activities, for example, grant retreats where researchers can go away for a day and devise a research project. So it's all sorts of advice and help to you because they want people to apply for this research funding, basically. There's now, as part of the RSS, a National Specialist Centre for Social Care, which I'm part of at the University of Manchester. I'll go into that on the last couple of slides. And that's where you can get more advice and guidance than I can give you today. So that's your next port of call, perhaps, if you're interested. Right at the end of this presentation, I'll give you some details about that. Lastly, I won't go into this in a too detailed a fashion. It can get quite confusing, but there's something called the Clinical Research Network as well as part of NIHR. These are professional staff, mostly nurses, it must be said, who will help you deliver your research once it's funded. They'll help you approach research participants. They'll help you sort of access routine data, for example, within a care home or a local authority or an NHS trust, if that's part of your research. They'll help you along the way with other research teams as well. So it's a very useful function and it's really helpful, but that's once you've got the funding and once you've got a research project off the ground. So how could you engage and contribute to social care research, perhaps with all this infrastructure around? Well, you can do it in one of 4 ways, or all 4 ways, if you like. You could be named as an advisor to a research team once they've got a research project funded. So they might want you to be on an advisory panel to help them with their research, and you're bringing your professional knowledge to that research project. You're a kind of external advisor to a project or a research bid, you know, at the bid stage when the research team are applying for funding. And you can be costed in to do that. You can be, you know, rewarded for that, not just travel expenses, but a fee, etc. So that's one way of maybe having a taster of what research looks like, getting involved in that with a university, perhaps. Next, you can be a collaborator offering your expertise and knowledge to a research project. That's more of an active role. You're not leading the research, you're not driving the research, but you're collaborating, for example, perhaps on getting the knowledge from the research out there to other practitioners or managers or the system as a whole that you work in, kind of being a knowledge broker, as they call it. You can do that. You can be named as a formal co-investigator on a project, what they call a co-investigator. You're part of the team then. You're perhaps leading on a specific element, and you can be costed in for your time with perhaps a university research team. So your time can be backfilled for the time that you join the project. So that's a much more active role. Lastly, and this is when you're leading the research, you can lead or co-lead a research project yourself or from your organisation with perhaps a university research team as what they call a principal investigator. And in that sense, it's your research then, it's your idea, you're driving it. You and the organisation are costed in then to undertake the research. So there's a mix of things you can do. So I'll just pause slightly and offer this slide. So maybe you're confused about all that. Maybe it's all a lot of information. You're scratching the head a little bit. You're not sure how all the parts of the research infrastructure interact. So I'll just go into that a little bit now. So I'll go into 2 things. The first thing is I'll just give you an example of a funded research project that's involved home care providers as collaborators. And it just gives you a kind of take on what a research funded programme by NIHR might look like. So this is a very successful project which is just finished about April this year from Dr. Monica Leverton in King's College London. Monica has instigated a kind of home care forum with home care providers down there in London, but it's available for anybody geographically across England to join. And she meets regularly with home care providers, and they're creating research projects together. So she's a university lead with home care experience herself, and is working with home care providers in creating research projects. One of the most recent ones is DemChamp there on the slide, and that's developing the role of dementia champions in the home care sector. Some of you might be aware Dementia Champions is a kind of role that's developing in NHS trusts now as well. And Monica wanted to sort of explore how that could develop in the home care sector, what's needed, what the role might look like, what needs to be instigated by home care managers perhaps to protect time for that role, and what that role may look like to the home care worker themselves, and how it perhaps may benefit people with dementia and their carers living at home that are supported by home care. So it's quite a neat little project, and there's a nice little video now about 4 minutes long. So I thought I'd play it to you just to give you an idea of what a research project looks like from the point of view of the provider. And this little animation there on the left that I'll just click in a minute, it kind of gives a nice little neat story of the research in, less academic words than we use sometimes. So it's quite nice, I think. So I hope it works, Sue, this time. We tried it out, didn't we, earlier? Let me know if you cannot hear it once I click.
All good.
So I'll just go on to the next slide, but I'll pause just before that, before I present this slide, and just talk to you a little bit about that video. So that video was created with home care providers and with an animation company, obviously, and it just shows a quite a neat project which wanted to explore the role of dementia champions in home care, but it did more than explore, and it's that pathway to impact that I talked about. It explored what the role might mean, but then explored how it could be implemented in practice within home care providers, and what sorts of commitment from management, etc., what sorts of time commitments are involved, and what kind of guidelines the dementia champion might need in terms of to do their job more fully. So it helped to create a kind of service within the service that people have talked about, but and then sort of generalize that information to help other care providers perhaps generate that role within their agency. So very practical, very applied research project that was funded by NIHR. So next, and lastly, I'd like to talk about the research support service that I mentioned, because that's the avenue, I think, for most of you next to explore more what research is and what you need to do to set up a research project or collaborate in a research project. All sorts of advice available specifically for social care. So I'll go through the RSS now, if that's okay. So it's quite new, the RSS, Research Support Service. From November last year, there was a forerunner of this called the Research Design Service in NIHR, but it's done more than change its name. So it's become a national service split into separate hubs geographically. But you don't have to go to the hub that's nearest you now. You just go to the Research Support Service, and I'll post a link in right at the end. You can go directly into the web link there. But as part of the contract, really, from November within NIHR, there's now a national specialist centre for social care as part of the RSS, where you can get social care specific advice. So basically free and confidential advice. It's free to you. Support from a broad range of experts in social care, university researchers mainly, but also links to a lot of different partners and possible collaborators, from social care providers to small and medium-sized businesses, all sorts of advice available there. I'm part of the RSS at University of Manchester, the National Centre for Social Care. As part of that is led by Lancaster University as a hub, and it contains representatives from Manchester University like myself, Manchester Metropolitan University and Liverpool University. It's a northwest based hub, but you don't have to be in the northwest to approach it, because currently it's the only specialist advice centre for social care research. There may be more in the future, but at the moment it's the only one. What does the support include? Well, we can support you at all stages. You might just have a research idea. You might be a little bit confused and think, I've got this sort of idea. I've heard there's research funding around. How do I access it? What research stream would I apply to? Who do I need to work with? What's the kind of infrastructure around it? What are the legal ramifications? What do I need to know further? So it can be very much at early stages. You can seek support about that. And it's right down across the research life cycle, as we call it, advice, both at that stage and as you're submitting a research bid, and even afterwards, to help you support with putting you in touch with people that will help you get your research off the ground. So we advise on all that, study development and delivery, and also advise on linking your research with members of the public or service users that you might need to interface with, and developing inclusive research, which is a big push by NIHR. The research must be inclusive of all populations, particularly underserved populations. There's opportunities with the RSS advice. We can put you in touch with university researchers and other collaborators that we know about. We have quite sophisticated networks across the country of other researchers, other research groups, other providers, and centres of research excellence. So we can put you in touch with people, and we can signpost you to other sources of advice and support, perhaps from other bits of the NIHR infrastructure I mentioned, like the Clinical Research Network, for example. We provide advice on the whole range of social care research. There's a few little taglines there, including quite innovative research that's ongoing in settings like prisons, mental health settings, etc., criminal justice system, adult social care, dementia, home care, care homes, etc. The whole range of what we might call social care settings. Now, this is my last slide, and it's the most essential slide, I think. So if that was sort of dipping our toes into research and what it entails, there's a lot of information, and I appreciate often, particularly social care providers, do work differently to university researchers like myself. So they tend to talk about things, meet and talk, rather than write everything down. Research is very heavily kind of written based and application form based, which can be a bit of a difficulty for home care providers in particular. They're not used to the research application forms, etc. We can advise on all that. Can advise on all the things I just mentioned. To get in touch with the RSS, and particularly the Research Support Service Specialist Centre for Social Care, I've made it easy for you. So there's a QR code there. If you just go into that QR code or click that link, you'll get into the web link for Research Support Service. Down the bottom of that link, there's an explanation about how you get in touch with us. There's a completion of a very simple kind of expression of interest form, I guess you'd call it, saying what your query is about. It might just be, I think I want to do research on such and such. Can you help me? I'm at an early stage. I haven't got an idea yet. Or it can be, I've got a little bit of an idea. I'm working with somebody at the moment. Can I meet with somebody to advise me on what next? You could have an idea all in motion. You could have a piece of tech, for example, that you want to evaluate the success of. So you could get advice on that, how to take your idea further forward. It could be a very worked up idea. You're already perhaps working with a university. Some care homes do this. They've already got a research team, but they want to work out which research streams should I apply for, and how do I go about it, because it's my first time. So if you go into that link, and you can get a link to that expression of interest form, you complete it. It takes about, I would say, about 5 or 10 minutes to complete, and that submits it to the Research Support Service. We have a kind of triage system, so somebody looks at all that and somebody will get in touch with you very quickly as we possibly can. We try and aim to get back to people within a week or so. And then you'll be assigned somebody to advise you, and that person can pass you on to other people as well for other sources of advice. Most of our advice at the moment since November has been done via Teams or on a Zoom call, whatever's best for you, but we can also communicate by email as well. With it being a national service, very difficult to meet people in person, but there are events planned, and we do envisage some kind of outreach service where we go and speak to people, but that's in the future and that's not been funded yet. So I would advise you to click on that link and have a look, because this, as part of NIHR, this is a contract to people like myself at the University of Manchester, for example. This is an NIHR contract to us, so I would always willing to talk to people. And I'll put my email in the next slide. Always willing to give a little piece of advice, and as part of the social care innovators as well. But if you want really more sort of sophisticated advice, click that link and get in touch with one of our advisors, because this is a contract that we have with NIHS, so we do have to sort of justify our existence, as it were. We want, we're funded to do this, so we want to make sure NIHR know that we are supporting and advising as many people as possible. So that's useful, Sue, I think, for people to use as the last slide. That's the most important slide, I think. But you can always contact me. That's my email if you just want to have a little sort of piece of advice, or how do I go about doing this, or if you've got any difficulties with that expression of interest form, etc. I'll stop there, and hopefully it might give us some time for any questions or discussions, Sue.
Yeah.
Should I stop
yeah, if you stop
sharing my
yeah,
slides, because I can't see everybody.
Great. Okay, super. I mean, that was fantastic, and I absolutely loved that video, because
it's a lovely video, isn't it?
It is, and it ties in, because I'm actually doing some work on career pathways, and I think that particular video, if I could have the link to that video, then I can start to weave that in, because there's so many other specialists as well within home care, and it would be great to get a similar sort of video for those different types of people as well, for those different types of specialists, because not everybody wants to do the formal qualifications and the MVQs, right, and it's fabulous. That's brilliant. Thank you so much.
I'll send you the link to Monica Leviton's research page at King's College London. That has the video in and everything, and it's got some quite nice other bits of information as well. Yeah, she's made research sort of accessible to people that have never engaged in research before, showing what the research did and what it kind of provided to home care providers. It was more than just exploring. It gave them something like a product that they could disseminate through their organisations.
Brilliant. Thank you so much, Paul. I'm going to open this up for questions. I know, Joe, you actually, I think it was yourself who came on, and you were interested in terms of what that research. So I'm hoping if you've got any questions for Paul, then please do come on now and ask away. Hi, Joe.
Hi, Paul. No, thank you. That was really interesting. So kind of we're just right at the beginning as an organisation. We've spent the last 2.5 years getting the services where we need to, but now I want to expand a little bit and do some research. And we've got some ideas of what we want to do. We want to do something around outcome measures for mental health and supported living. So this session today has just given me a really good kind of like starter, because I'm a nurse by background, but haven't ever been involved in research. So it's great to have that just little introduction and some pointers of where to go next. So thank you, Paul. And I agree. I thought that little video was fantastic.
Yeah, it's very humorous, isn't it? It made me smile when she squeezed the home care worker's hand. And So what I say, Joe, is certainly go on that QR code. You don't have to do it straight after this meeting, unless you're really itching to, do it whenever you want. You'll get an advisor that's specifically orientated towards mental health research. I do know by in person, quite a few of the advisors have specifically mental health, social care experience, both practically in services and as university researchers as well.
Okay, that's great. Thank you, Paul.
To do that, we need more mental health social care research that's care rather than treatment research.
Yeah. Great, thank you.
Thank you, Joe. Louise, did you want to?
Louise, you've interfered in my meeting, Louise. I know, Louise.
Hello, Paul. That was great. Thank you so much. I was just wondering, Joe, with what you do, are you community-based, care home, or you mentioned supported living? So have you got residential facilities?
No, we are supported living. We're not residential. We're not a care home. I do find it quite a grey area for a lot of people, like what is supported living. So we provide care in facilities which are owned by a housing association, essentially. So we have the company's Northern Healthcare, as you can see behind me, and we've got facilities from Birmingham to Carlisle, from Liverpool to Hull. predominantly in the north. But I come from an inpatient healthcare background, inpatient setting, and I've been in Northern Healthcare now for 2.5 years. And it has been a real struggle to get kind of like some really good, robust outcome measures. So we do amazing work, but we can't ever demonstrate it. We either do it through a person we support story, or someone's got a job, or they've moved on to independent living. Now I want something a little bit more robust than that we can really evidence the great work that we're doing. How do we evidence it? Because from an inpatient setting, we have lots of outcome measure tools that were, to hand, whereas in supported living, we just don't have that. So I see a real gap in that market for outcome measures.
Yeah, the reason I asked was if you were residential, there's Enrich, which you can link up with regionally. And if you're more domiciliary community based, which suggests that you're providing services in supported living facilities, then Relic can in some measure help. But there would certainly, as Paul said, there are researchers who are really keen to engage with services like yourself who would be really keen to get your expertise and your experience, and perhaps get you on as on their advisory project group, and all kinds of opportunities that open up doors that you might not be aware of that exist. So but just connecting with Paul is a really good start, because he'd be good at directing you to perhaps more local research community opportunities. And certainly the home care research forum that Monica runs, even though it's not strictly home care in the sense you are providing care in people's homes, it would be really worthwhile joining the free. And of course this the Institute's special interest groups, again, lots of doors open up, don't they, Sue?
Yeah, they do, certainly. Networking. And you know what, absolutely what I love more than anything is that this is, having a space for innovation and creativity within social care is, for me, it's like, it's just so amazing, because we do need to be in control of our own destinies quite a lot. And I know that there are so many people with the most amazing, fabulous ideas. And to bring that to life is, for me, is just like, wow, it's fabulous.
So Sue, when I send you the Monica Leviton's research page with that video, there's a link there to the home care forum that Louise mentions, Jo.
Great, thank you.
She runs it quite regularly.
As well.
And you can join that. And they've created some great research projects out of it with the providers as partners.
Yeah, brilliant.
Oh, that's great. Thank you.
And what I'd say about your idea, Jo, your sort of tentative idea, is that would land really well with NIHR. I think supported living is a gap in the research market, definitely.
Yeah.
There's definitely a hole there without much research.
Yeah, and I think it's a real grey area. People don't know what supported living is, and even our inspectors don't always know. CQC inspectors don't always fully understand what supported living is. Yeah. Okay. Thank you so much, Paul. Thank you, Sue. Thank you.
Yeah. You're very welcome. And what the fabulous thing is the fact that you can get money for bringing your ideas into fruition is even better, because it does take a lot of effort and time and resource to create this. So the fact that there is a pot of money, lots of money, as Paul was saying, available to people is even better. So definitely great to have access to that. Has anybody got any further thoughts, questions for Paul? Okay, well, have you got anything else you'd like to say, Paul? Is there any other?
Yeah, I'll end with a positive, if that's all right, because that's the sort of person I am, Louise, isn't it? I'm lying, really. I'm grumpy, really, but you're not saying anything, Louise. because I've gone through some of the challenges in the slide. You know, research is really heavy on paperwork. That's a negative for people like me. It's mired in bureaucracy, but that's necessary because there's been a lot of legal strange things going on in the past in research, you know, not good research. So you've got to protect patients and service users, got to protect research participants, got to protect universities from doing bad research. So it's all there for good reason. So that's the sort of downside. But the positive about NIHR and research at the moment is, well, two things. First of all, NIHR as a body, as a thing, it's a huge supertank record. It's got a lot of money. It seems to, obviously, it's the research arm of the Department of Health and Social Care. It has to basically go to the Treasury every year and argue for research funds as against, you know, other spending. So it's publicly funded, it's public money. And it seems to be quite successful in doing that. It seems to be really successful in gathering money for research, because I think we learned in the pandemic especially just what research can do. So the NIHR research brought us the trials for the vaccines, for example, so international trials as well. So it works. It works as an institution. It helps health and care. So that's why it's funded. So that's the first positive. It's a huge infrastructure that can actually help. The second thing is just how what a priority social care is for NIHR at the moment. So there is a lot of money swashing around over the next 5 years, and our job at the RSS is to try and ensure that people that want to get those funds to create research projects have a better chance of getting them, because it's not 100% success rate. You have to apply, and sometimes you do get rejected. You can apply again, but our job is to ensure that the research applications are of the highest quality, and we do that by putting you in touch with as many people as possible to make it as competitive as possible. So those are the two positives, I think.
Brilliant. Thank you, Paul. Helen, did you want to come in there?
I was just going to say, no, thanks very much, Paul, because that was I do hear periodically about the Research Support Service, and obviously from where I sit within the coordinating centre, I recommend people to talk to the Research Support Service all the time. I think you very neatly conveyed the fact that it is a paper-based system and has very much an academic outlook. And so when I talk to companies, or when I talk to care providers, that is a real barrier, and you are key in addressing that. So thank you very much for this session.
Yeah, it is a barrier, Helen. I agree. It's
Yeah.
because I was a social worker in the past, and before that I was a community worker, and I remember we were businesses really. We got things off the ground by talking and interacting. We didn't write everything down. We didn't fill copious forms out, but that's the way academic research, unfortunately, is done. And often we're sort of talking from different angles, aren't we? University researchers and social care providers in particular. And it's not our fault that we're mired in this bureaucracy. We don't like it either, but yeah, we come from different directions, and that often puts people off research. And what puts them off as well, I think, is the sort of output of research in the past, which is all academic research papers, which are important for getting the messages out there, but they're for an academic audience. So that's why things like Monica's cartoon is really nice, because that's kind of explains the project to people on the ground, doesn't it, and helps them kind of conceptualize it.
Yeah. Well, thank you very much for your time, Paul, today.
Thanks.
And thank
for
you
having
all
me, Sue.
for attending as well. This session will be recorded. I will be sharing it in my monthly newsletter as well, because I think it's such a valid piece of the work that you're doing here. So thank you, Paul. Thank you so much, and hopefully see you all again soon. I'll give you 6 minutes back of your day.
Thank you,
Thanks,
Sue.
folks. Nice to see you all.
Thank
Thank you.
you. Take care. Thank you.